Hello, and welcome once again to this channel. My name is Dr. Rosemond Abwade. This is a very special edition, particularly aimed for our prescribers, doctors, nurses, midwives, physician assistants, anybody at all who has a privilege to request for a radiological investigation. This is for you. And so I'm going to start with a story. There was this day I woke up very early to a notification, and it was an x-ray that I needed to report. It was a chest x-ray. When I opened my laptop, the first thing that struck me was that there was a very small amount of free gas under the patient's diaphragm, but the history was just breathlessness, a 19-year-old. And so I was wondering, am I seeing right? They are talking about breathlessness and I'm seeing free gas under the diaphragm. What is happening with the patient? And so I called my radiographer and I'm like, what did the patient come with? How did he look like? Was he in pain? Was there anything specific to the abdomen at all? It was then that he told me, oh yes, his primary indication was that he came with abdominal pain, and the doctor actually requested for a scan to see if there was anything in the abdomen as well. And so that confirmed to me that really what I was seeing was a pathology. And so it brings me to a very, very major concern for us. Anytime you request for any radiological investigation, be it an ultrasound, a CT scan, an X-ray, please, we need you to give us your clinical indication. Tell us why you are asking for the scan. For example, when you are looking for appendicitis based on the patient's clinical presentation, you need to tell us that you are worried about appendicitis. When we do an abdominal ultrasound, there are a lot of things we can look out for, and there are very specific maneuvers that we would have to perform to rule out an appendicitis. And so if you write abdominal scan without any history, and you don't indicate that you are worried for appendicitis, in a very busy place where the sonographer or radiologist has not had the privilege to talk to your patient and find out all the problems that they are coming with, they may just do an ultrasound and not do the specific maneuvers that will pick up an appendicitis. So by all means, when you request for any radiological investigation, tell us your clinical question. What are you concerned about? What are you looking for? You can even go ahead and tell us a little bit about the patient's presentation, and that will go a long way to help us to narrow down on our differential diagnosis and to look at the right places to give you the best possible answers. When you send us a request, please write the patient's name clearly. We also really need you to tell us the age of the patient, especially in pediatric patients. A 1-day-old baby and a 1-month-old baby are not the same. And the differentials would entertain us so different based on their age and their clinical presentation. Tell us the age of the patient. Is it 1 week? Is it 30 years? Is it 60 years? Is it 90 years? I expect somebody who is much older to have osteoarthritis. So if I have a 20-year-old adult with osteoarthritis of the hip, my differentials and what I would consider are very different from somebody who is like 70 or 80 years old. For a patient with sickle cell disease, the things I would consider and the differentials I would give you are very different from somebody who does not have sickle cell disease. And so the clinical state, the medical history that are relevant to differential diagnosis, when you write your request form, please put them on for us. You know, when you write a request form, it is like a referral. The way you write a referral to a gastroenterologist or to a renal physician to come and review the same patient, you give them details about what they presented with, your clinical findings. We need the same kind of information if you want to get the best out of us. Okay. The other thing that we would love for you to do for us is to put down your name, if possible, the hospital you are referring from. A lot of hospitals have their name on the request form, but there are a few of them who do not have, Ghana Health Service, just that. And so it is difficult for you to tell. Let us know the hospital you are referring from. If possible, add your number Sometimes as a radiologist, I want a little more information, or I need to have a discussion with you as a colleague. I want to call you. And so if you can, add your personal number. Even if you can't and you can give us the hospital's number, it is great so that we can reach you. Thank you very much.